what we did basically was conduct a one-year longitudinal study to really look at the relationship between learning environment experiences assessed in the second year residency and subsequent risk of burnout in the third year residency in a national sample of residents. So my name is Lottie Derby. I'm a professor of medicine and medical education at Mayo Clinic in Rochester, Minnesota. And I'm going to talk about our article, a longitudinal study exploring learning environment culture and subsequent risk of burnout among resident physicians overall and by gender. So there's basically three takeaway messages from our paper. The first message really is that women in residency training are more likely to develop symptoms of burnout and have worsening in the severity of their emotional exhaustion between the second and third year residency in comparison to men in residency. The second point is that negative interpersonal experiences, which is really a marker of learning environment culture, was strongly associated with the odds of developing burnout as well as the severity of burnout for both men and women. And the third point was that the differences in burnout between men and women was at least partially due to differences in the level of exposure to negative interactions for women and men versus a negative interaction having a differential impact on the well-being of men versus female residents. Participants were recruited way back in the first year of medical school, actually, as part of the Cognitive Habits and Growth Evaluation Study, otherwise known as CHANGES, that was funded by the National Heart, Lung, and Blood Institute, with PI being Dr. Michelle Van Ryn, who is at Oregon Health and Sciences University. So for this particular study, we looked at residents in the second year and then again in the third year of residency. And the survey included a negative interpersonal experiences scale, which basically assessed psychological safety and bias, feelings of inclusion and respect and justice, an unfair treatment scale, 2 items from the Maslow burnout inventory, and then we were able to link responses from the second and third year of residency. And what we found is that the women residents were more likely to report more negative interpersonal experiences and more unfair treatment during the second year of residency relative to the male residents. We also found that the women residents were more likely to develop burnout between the second and third year and have worsening in the severity of their emotional exhaustion between the second and third year residency training in comparison to male residents. And that persisted even after we controlled for a variety of personal factors, learning environment, culture, and specialty, as well as baseline measures of well-being. We then found that for both men and women, when they had more negative interpersonal experiences in year 2 residency, they were more likely to have burnout 1 year later in the third year of residency, and that the factors contributing to burnout really didn't vary in magnitude between women and men, meaning that the strength of the association between negative interpersonal experiences and burnout did not differ significantly by gender. So the differences that we saw in burnout between men and women was really due to women having a higher level of exposure to negative interpersonal experiences in the second year of residency. It wasn't that having a negative experience somehow had a bigger impact on women than it did on men. So if the male residents were experiencing the same degree of negative interpersonal experiences, we would see a narrowing, if not elimination, of the differences in the prevalence of burnout by gender. So how does this really relate to the clinical practice? Well, I think we're all aware that burnout is strongly associated with suboptimal patient care. It's associated with medical errors, it's associated with lapses in professionalism, etc. And in this study, it was the interactions that residents were having in the clinical practice. That is, their interactions with their attending physician, with the nursing staff, with the clerical administrative staff, with other allied health staff, and with patients. It was these interactions that related to their risk of burnout. And these findings really further solidify the need for system-level interventions within the clinical practice so that everybody can thrive. We need to get rid of these negative interpersonal experiences that residents as well as other healthcare workers are having if we're serious about mitigating the risk of burnout. The National Academies of Sciences, Engineering, and Medicine has a report, a consensus study that delineates strategies organizations and others can take to really improve the work and learning environment. And in terms of what does it mean for patients? Well, patients obviously want optimal care by empathetic, highly professional physicians. And in order to get there, we really need to focus on the system level factors. So what is driving, how do we improve psychological safety? How do we eliminate bias? How do we make people feel included and respected? How do we ensure that there's justice for all learners and really all healthcare workers? When we're able to really improve the work and the learning environment, that's when we're going to get to being able to really provide optimal care for patients. So in terms of next steps, there's always a lot of them, but one immediate next step certainly is we need more research to understand why women are reporting more negative interpersonal experiences and get a better understanding of how we can address them. So what are the most effective strategies really to eradicate a negative learning environment? That needs to be tested and then ultimately implemented. So thank you very much for your attention. I hope that you enjoy reading the article.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.